I think there's one very simple thing, which is I think people are more likely to comply with their therapy if they don't want to disappoint their provider. So everything everyone has said makes a lot of sense, but that's a pretty basic part.
Oh, well, I'm gonna just play a little bit on the comments from the amazing people in the room. I thought they were all really insightful. One of my favorite things about this work we do is that we get to build relationship with people who are thinking differently about healthcare. I heard someone say that, patients do better when they trust their providers, and I would turn that around and say healthcare can do better if we trust families and communities to know best what families need. And I heard someone say that, patients will be able to comply, right? If we determine, what path is going to lead to wellness. And I think in our system, we think about that from the opposite perspective too, which is, how do we do a good job listening to people and families and using their direction to build a healthcare system that complies with their needs. So really there's this play on where power sits, and that trust and relationship is the way that you get to that.
My personal tolerance for words that our staff and other people say is pretty big. And so, we try not to use the word patient anymore. We use customer owner, lots of things in terms of words. But the one that just I don't tolerate is whenever anyone talks about patients being compliant. As April already said, it's the other way around. It's how do we comply with their wants, needs, and wishes and support them on their journey. And to judge people as compliant or non-compliant because they followed or didn't follow what we in our professional and institutional arrogance told them to do is offensive and does harm and is abusive.